Hey everybody, this is Dr. Daniel Davila, chiropractor with DuPage Pain Management in Willowbrook, Illinois. And in this video today I want to share a little known link between spine health and the risk of developing a heart condition known as cardiac arrhythmias, or more specifically atrial fibrillations. Now for anybody who's watching this who doesn't know what a cardiac arrhythmia is, it's an irregular heartbeat or an abnormal heart rhythm that is potentially life-threatening. And the reason why is because it can lead to sudden heart failure, possibly even a stroke. And it's estimated that as many as 58% of the population will be affected with this at some point in their life, either due to age or some other kind of physiologic dysfunction in the body. Now, in this particular study that I'm going to share with you here today, this was published in the Journal of Clinical Medicine in 2018. And what they wanted to look at was, is there a link between the development of cervical spondylosis, otherwise known as neck arthritis, and the risk of having a cardiac arrhythmia or atrial fibrillations? And what they found was pretty surprising. They actually showed that if you have neck arthritis, you have a 3.1 fold increase in your risk of developing cardiac arrhythmias and atrial fibrillation. Now this is pretty fascinating because what they also found was that if you go through a course of conservative rehabilitation to deal with the issues that caused the neck arthritis in the first place, well, your risk of cardiac arrhythmias and atrial fibrillation actually goes down. The reason why they speculate was very interesting. They said that if you think about the anatomy of the neck, imagine this is your neck when we're looking at it straight on. You can see on either side of the neck you've got, in yellow, these little nerve roots exiting the spine. In red, going through some of the joints here, you've got the vertebral artery providing part of the blood flow to the brain. Unfortunately, what's not pictured on here, but what's very important for this discussion, is on either side of your neck, you've also got little bundles of nervous system tissue that are known as the cervical sympathetic ganglia. Now, the cervical sympathetic ganglia are part of your body's fight or flight response, and what these researchers speculated was that if you have neck arthritis causing mechanical irritation of those nerve bundles, well, your risk of atrial fibrillation goes up precisely because your body's fight or flight mechanism is essentially out of whack and your heart can't respond appropriately to the stress you experience on a day-to-day basis. They actually found that in particular the C4-C5 nerve junction is the most commonly associated with the development of cardiac arrhythmias and atrial fibrillation. Now, why does this happen? There are many potential reasons why somebody can develop arthritis in their neck. Most commonly, it's due to trauma, but it can also be due to poor posture. Just, the way you carry yourself throughout the day. If you're somebody who works with computers, or if you're somebody who's working with your smartphone, doing this all day, it's especially common in young people these days. Well, unfortunately, that abnormal stress in your neck is going to increase the likelihood that you're going to develop arthritis over time. Other things include motor vehicle collisions, if you've ever fallen off a horse, things of this nature. Just stress and damage on the neck is what's going to predispose you to developing arthritis over time and potentially increase your risk of developing not only atrial fibrillations, but things like neck pain, disc degeneration, vertigo, headaches, other issues related to dysfunction and abnormal nervous system function through the neck itself. So what we know then is that if we put people through a course of conservative drug-free rehabilitation, this may help to decrease the likelihood of them developing these atrial fibrillations and cardiac arrhythmias. So what does that look like? In my office here at DuPage Pain Management in Willowbrook, I specifically use the chiropractic biophysics technique of chiropractic to help use specific adjustments, specific exercises, and specific forms of traction to restore normal joint mechanics, to alleviate irritation from the discs, the nerves, and the joints of the neck and the rest of the spine. This in turn allows for better nervous system communication, better joint function, lower risk of injury, and in this situation, it may actually help to decrease your risk of cardiac arrhythmias and atrial fibrillation. Now, I want to share that with you all because I think it's very important that people be made aware of what their drug-free conservative care options are, regardless of what the health issues are that they're facing. This particular study lends evidence to show that conservative rehabilitation, including corrective chiropractic care, may be useful in helping people with cardiac arrhythmias and atrial fibrillations, or even reducing the risk of people developing those issues from the get-go. So I want to share this with you all so you can be made aware of this. If you found this useful and you think it's useful for somebody else that you know, please like and share this so that they can get this information. If you are wondering if we might be able to help you out with your neck arthritis issues and your potential nervous system dysfunction, you can always call my office at 630-887-9400. Give us a call, schedule yourself an appointment so we can get you in, check you out, see what, if anything, is going on that we can help you with, and we can get you taken care of as soon as possible. If you have any questions or comments about what I've said here in this video, please go ahead and post them down below. Otherwise, have a great day, take care of yourself, and be well.